Psychosocial issues. Just like the complex medical issues are very important, the psychosocial issues, or what goes on at home, what goes on in the social life, what goes on between the child and their friends, what goes on in the child's own mind, are very, very important issues and powerful issues, which may, again, be the most important aspect. We know, studies show that kids and families with disabilities have more psychosocial issues. Not that every kid that has a disability has problems. That's definitely not true. And plenty of kids without disabilities have psychosocial issues. We know that. But if you want to do a good job in interviewing kids or in any kind of service to children with disabilities, you need to be aware of these. And these are a few of the major psychosocial issues that are on this slide. Anxiety is very important. A lot of the kids now in the United States have anxiety. It's increased drastically in the last few years, particularly since 9/11. So that's a known fact. Kids with disabilities, they're vulnerable, and they can get nervous. They can be anxious about things. They can be depressed and sad, especially teenagers who start to realize that they're very different from other kids, that they may never do certain things, they may never enter into the kind of social relationships they want, they may never be able to do the kinds of things, and that can make them sad. Many kids, especially kids with physical disabilities, have self-esteem issues. Their body images may be distorted, they may not feel as good about themselves as other people do. And so, that makes them vulnerable to other people who may offer them things and may say, "Oh, I like you." Many people, they don't hear that very much. And I'm going to show you some information from some recent studies about that. But so kids may be vulnerable to people who say, "I like you, and I'll do this for you if you do this for me," which puts them in compromising situations. Independence and separation. We know that in the lives of so-called children without disabilities or so-called normal children, as you get older, you become more independent and you separate from your family. That's what happens in our society. Many times kids with disabilities aren't able to do that. They can never really develop that full, at least physical independence and separation, so they're always in a somewhat of a different kind of relationship with their parents, because they are often, many times, very dependent and totally dependent, and maybe independence in their mind is possible, but independence as far as their body goes may not really be an option for them. Plans for the future are often anxiety-provoking. A lot of these kids find it hard to see how they're going to be able to do anything in their life when they're so dependent on medical input and medication and people helping them all the time. It's hard for them to understand. And transitions are very difficult. Whether it's a transition from preschool to kindergarten or from, elementary school to middle school, it's very hard because kids, they get used to doing certain things, and then when something changes, it's not like some kids where, it takes them a couple days to get used to it. It could take some kids, months or even a year to get used to a change of an aide, of a person who's helping to take care of them. The kids get very dependent on certain types of situations, and if something changes, it can be very hard for them to adapt. Not all kids, but some kids. Social isolation is a very big problem. Many kids with disabilities don't have any friends. They hang out with adults, but kids their own age don't really want to, they don't want to play with them. They see them as being different. They can't play ball with them. They can't do this. Some of them have trouble talking, so they are very socially isolated, which makes them very vulnerable to victimization. Their peer relationships often suffer. One important point is the lack of privacy. Many of these kids are never alone. They never take a bath by themselves. They have very little time by themselves, which it changes your outlook on the world. Kids learn that certain things are the way you're supposed to act, and certain things aren't. We know kids are taught you're not supposed to be naked in front of anyone except for, say, your parents up to a certain age. But kids with disabilities oftentimes are undressed in front of other people. And, they may, not all, but they may lose that kind of, societal feeling that they shouldn't be. And it's hard for them to develop that, which makes them very, it's hard for them to understand all the time what they should be doing. As they get older, most of the kids do understand that, but certainly when they're younger, it's very confusing. Frequent hospitalizations, we touched on, it's disruptive to the family, it's disruptive to the child. It's scary, it can be painful. A lot of these procedures are extremely painful, especially the operations on bones, scoliosis surgery and hip surgery. The recovery is often painful, and kids don't like that. It's hard to explain that to kids. An adult, they can see the future. Children just see the moment, and they don't really like that, and then they can be upset about it. And behavioral problems, we talked about. Family problems, we will talk about. Just a little more information. Some people feel that up to 50% of kids with cerebral palsy have attention deficit disorder or depression. Some studies, not recent, this is an older study, show that kids with neurological problems have psychiatric disorders, and it's up to 5 times what's normal in the general population. So again, like I said, like we discussed earlier, you need to get some more information, and you need to know, are there any behavioral issues as well? What are all the physical problems? What are the behavioral problems? What's the child's cognitive ability? Before you can really do a good job in assessing a situation. Traumatic brain injury, which we see more and more these days. What is traumatic brain injury? Well, kids who've had their brain injured from car accidents, could be infections, gunshot wounds, near drownings, any kind of accident. So what happens? So the kid gets hurt, and then they're in the hospital for a while, and then they recover a lot of their physical activity, but their behavior has changed. Their personality has changed permanently, forever. And many times people don't realize that. They see that the child is doing more for themselves, they're walking better. They don't realize that there's a lot of behavioral issues that are still there, whether it's being inattentive and impulsive or aggressive or hyperactive, or being withdrawn and poorly motivated or depressed. Those are the kinds of things that, most of the time need to be known ahead of time. And if you're going to interview someone, you need to know that. You need to know that they have problems with impulsivity, that they blurt out answers, or that they tend to be withdrawn, and then you would approach that child in a different way, and we know it's more common in kids with disabilities, so it needs to be something that you know pretty much up front. I'll just explain this a little bit. What this is this is a study from the National Center on Secondary Education and Transition, which does follow-up of kids with disabilities. And what this shows is that the number of kids who never, the red is the kids who never see a friend outside of school. And you can see an MH, which is multiply handicapped, or the OI, which is orthopedically handicapped, the tremendous number of kids who never see a friend outside of school, which is so different than typically developing kids. And this is another sad statistic, phone calls from friends. You can see that, over 60% of kids with multiply handicaps, almost 50% of kids with orthopedic handicaps never get a phone call from a friend. These are teenagers, these are high school students. So you can see the kinds of stresses and social isolation, and where many of these kids could be victimized, could be abused, could be put into compromising situations because they are so very lonely. That's the children. That's the problems with the children. What about the parents and families? Plenty of families with kids with disabilities are intact, doing well. They're doing the right thing, and they have all the services they need, but many, many do not. And if you remember the information that I showed you earlier on health services, you can see how many problems these families have. And they're for many reasons. Financial demands are overwhelming. The way things are going lately, kids are getting less and less services. They're getting, health services are being cut, whether it's Medicaid or private. It's very hard nowadays to get appropriate financial reimbursement for medical services. Many people are finding it harder and harder to get services, particularly mental health services. It's extraordinarily difficult to get mental health services for kids with disabilities. Recreation services, respite care, which is where you can have your child be taken care of for a couple hours by someone who's skilled in it, is very hard. The services are being cut. And then what happens is that the parents just get overwhelmed. You know, they have a child that needs constant attention. Doing that hour after hour, day after day, month after month, year after year. Many of these families, they never take vacations. They never get to go away. It can, you know, affect you and the way you start to see your child. You know, they can start to become annoying to you, problematic. Parents have very little privacy. They're constantly taking care of their kids. Then they themselves can develop some anxiety, sadness, and depression. And depressed parents are not very good for kids. They can't think their way out of difficult situations. They can't reason their way out, and they stop doing things for their kids. Some parents get angry. I mean, some parents find it difficult to handle these kids. They need guidance and support. It's hard to get. The kids are in the hospital frequently. The parents have to take off from work. They get fired from work. They don't see their spouses because they're in the hospital. They become like, you know, little nurses. Their houses become little hospitals. The bedrooms become little ICU units. And that takes its stress on the family, on the marriage, on siblings. You know, oftentimes, I mean, there's a lot of information on siblings, brothers and sisters of children with disabilities. Many times they do great. Many times they rise to the occasion. But other times they become resentful. They see the disabled child or the child with a disability as taking away resources from them. There can be a lot of anger towards them. Sometimes it can result in, you know, abusive situations.
The other research that we've been seeing is also related to siblings and abuse, especially in families with children with disabilities. Oftentimes we hear parents tell another child in the family, "You're lucky, you're not like your brother," or "This is the least you can do." Sometimes I think the child with a disability has more of the focus, and parents, families, systems forget about the vulnerability of other kids in the family, the siblings. And maybe we really need to pay attention to that. Is that right?
That's a very good point. And some families, they plan the future that the sibling's going to take care of the child with a disability. And then many times the sibling doesn't act that way, and then the parents can get mad at them and kind of withdraw from them, and, "Oh, you've let us down," and then that child can look elsewhere for support. There's an interesting study on children with spinal muscular atrophy, which is a disability that's like muscular dystrophy, and they did the mental health of the child with the disability and the siblings, and a control group. And the interesting finding was that the group that had the most psychological problems were the siblings, which I thought was very interesting and not exactly what you would think right off the top. But I think it just speaks to the immense pressure on the families of children that have disabilities and the lack of support that they really get in our society. And again, planning for the future and transitions, just like for the children, it's very stressful for parents when everyone else is graduating, everyone else is learning how to drive and going out on dates and going to the senior prom, and, you know, your child is, you know, not going to ever really be able to do that. Or you see that your child will never be able to do that, and then you can get very, you know, upset. Some people get depressed and other people get angry, and that can happen when the child starts kindergarten, starts school, or any transition. Okay, well, we discussed a lot of information, and some of it is, you know, confusing, and I think it's important that we all work together towards understanding kids with disabilities and helping them. And I think that one of the things that you might want to do if you're involved in whatever interviewing, law enforcement, any other kind of area, is to find, whether it's a doctor, a nurse practitioner, any healthcare provider, whether it's a principal of a school for children with disabilities, someone who has a lot of experience as a resource, someone who you can call and rely on for information, up-to-the-date information and accurate information. And it may not be simple, but I think it's possible to do. You can call departments of pediatrics, you can call schools that specialize in children with disabilities, you can call me, you can call anyone who has a lot of experience, and parents many times can be a resource for you on who they rely on. And utilize those people to help understand difficult situations. I think it's important that you up front explain what you would like, what your responsibilities are, what you would like that person to do. If you want, you can make it a formal relationship between one agency or another. I don't think people necessarily need to be paid for that kind of stuff, but I think sometimes it's nice to get a letter, thank you for helping us. Make your objectives clear, the requests clear, and explain exactly how that person will be helping you. I think if you're persistent about it, I know that you can find people like that. I think it's important that we all work together, all the different areas that are involved with children and disabilities, help each other out. And then if a situation comes up, you have a child who you're going to be interviewing, or you interviewed, this child has muscular dystrophy. I don't really remember what that is. I can't find information. Give someone a call. They could explain to you or show you where to get good information. And then you'll be that much ahead of what you need to do. I think it's hard to find the information on the Internet. A lot of the stuff is inaccurate. Some of it's very confusing, and some of it is not really is not scientifically based. I think books, it's tough. Some of them are out of date right away. Others are too simple. Some are too complex. I know that if we all work together, we can really help kids with disabilities. We can help to protect these kids and to make their situations better. So I say be persistent, stick with it, and try to find people who can give you good advice. Thank you very much, and it was a pleasure.